Welcome aboard, everyone. Good morning, good afternoon, good evening to everyone. I see people joining from various countries, various time zones. So we'll get started. So today we are going to talk about the digital health beyond COVID-19. My name is Parag Sharma. I'm the CEO and founder of Mantra Labs. Mantra Labs is an AI-first products and solutions technology company. We have been at the forefront of building digital-first products and solutions for leading brands and enterprises. Some of our key partnerships are with companies like NVIDIA, IBM Watson, AWS, and others. We operate from two different offices, one main office in Bangalore, and the other one is in Gurgaon. Before we get ahead, let us look at the outline of our today's webinar. We will get started with understanding how COVID-19 has impacted our healthcare institutions, our hospitals, and other healthcare systems. We will try to understand how the hospitals have responded, how well they have been in their efforts in responding to the situation, what has really worked, what perhaps did not work very well. We also see that patient behaviors have also changed dramatically and significantly over this period of time. We will understand how some of the mHealth applications have come up in the market today and have picked up a really amazing and an appreciable contribution in terms of the healthcare state. We will look at how healthcare enterprises have responded appropriately, inappropriately. In some cases, there have been fallen short of expectations, but we'll look at some real world examples and also look at some of the case studies of our work with digital healthcare institutions. In the end, before winding up, we will summarize what should be the rightful approach towards building a successful digital health journey. Perhaps we will also uncover some of the potential pitfalls that we should avoid to ensure stickiness and in our applications. And then we will also talk about some of the KPIs that we can measure to ensure that we have a long-term successful digital health journey. In terms of the healthcare, we understand that COVID-19 has had an impactful time on the state of our healthcare institutions. Low healthcare utilization have impacted the hospitals and other healthcare institutions' ability to sustain regular cash flows and have been seeing problems with respect to their fixed costs. Amongst the most important contributing factors, it is the fear of contracting COVID-19, which prevents a lot of people visiting hospitals for getting access to their healthcare facilities. Non-availability of transportation, availability of over-the-counter medicines have also been other contributing factors. But what is also important to be noted is that availability of telemedicine and other facilities from the hospitals have also taken off some of this load from the physical visits to the hospitals. Many of the people have decided to postpone their elective surgeries, chronic, non-chronic, to a later date. Hospitals have, of course, responded in various ways by providing medical health kits for their patients, for helping them manage their health from the comforts of their homes itself. There has been remote consultations with doctors, with nurses, not just doctors and nurses, but also dietitians, and psychological consulting has also been provided from the comforts of patients' home through telemedicine means. What has been really innovative on this front is the e-literature and usage of technology like AR and VR to help people understand about their healthcare and how they could possibly retain a healthy lifestyle to make sure that they are safe and fit throughout these crisis times. Private healthcare systems in India, if you were to compare it with the public health, we would find that public and private health is almost hand in hand with respect to the reach of these institutions to a larger mass in India. 58% of the people in India get access to the private institutions or opt for private institutions for their healthcare needs, which is a significant number. Despite that, despite such a huge demand from the private segment, for the private segment in healthcare, we see that there has been a shortage or a shortfall. Perhaps hospital chains have fallen short of their ability in identifying the disease in time. They have not been able to very well conduct surveillance for diseases, testing of diseases, and the important fact is that the healthcare institutions in our country were never really designed for a pandemic kind of a situation where such a large number of people would get sick in a short span of time, and then they would need critical healthcare facilities, which unfortunately was not really existent. And whatever was existing was not really enough to be able to take care of these needs. What has really changed in our digital health segment is India's preventive healthcare market, which is almost expected to reach around $170 billion by 2025. From preventive healthcare, I mean there has been a significant adoption in wellness and yoga centers, in fitness centers, in exercise centers, which help people to remain fit and help them to lead a fitter and a more healthier lifestyle. The key focus has been, of course, in reducing the number of physical touch points, which is being made possible by advancement of digital solutions for the healthcare. If you were to look at how the modern healthcare consumer has, or the behavior of the modern healthcare consumer have changed over 6-7 months of the COVID period, we would see that from the stage one, when people were mostly concerned about proactive well-being, taking up products like a Dabur Chyawanprash, for example, to a more reactive and a preventive health mode. People started using with wearing of face masks, and finally getting on to a new normal, which is changing the entire structure. While people are returning to their day-to-day lives, but they are continuing with the health and safety protocols that has been evolved and developed during the pandemic to keep themselves safe. 90% of the people were comfortable reaching out to the hospital healthcare institutions for seeking advice for their ailments. During the pandemic, not more than 40 people have been comfortable doing so, which is a clear-cut indicator of the fact that people today are preferring home care than reaching out to the physical care hospitals and other healthcare institutions. People are tracking their health conditions, and using data, they want to make decisions to keep themselves fit during this period. If you were to look at some real numbers, 50 million Indians have used telemedicine, and 62% of psychiatric consultations were with youngsters between 21 and 30 years. What does this tell us? It tells us that more and more people are now comfortable in using some of these digital means for accessing healthcare for themselves and for their family. When we talk about 62% of psychiatric consultations, we are clearly seeing the trend that more and more youngsters would need psychiatry help, and this psychiatry help is easily available through digital means. While we see that there has been significant change in the In the patient behavior, there has been also an equal change in that we are witnessing from the doctors and other healthcare providers. 76% of our healthcare professionals are now comfortable in using the digital health records, which is a serious deviation in their usage a couple of years back. Doctors today are exploring more and more options and avenues with vertical pharmacy providers, and they are looking at possible engagements with them to help them reach to a larger audience and get and be able to provide healthcare facility healthcare to a larger number of patients from the comforts and safety of their homes. The major trends for the healthcare providers have been vertical telehealth consulting companies like Liberate, Practo, and others, which have seen almost a 3 times jump in the number of users since March, which is like almost 6 months back. So within 6 months, they were able to increase their user base almost 3 times than it was before. More and more doctors are also comfortable joining the platform, and the numbers have a staggering 50% increase in the doctor base since that duration. Interesting fact is about mHealth apps, which have almost reached to a target segment or a target market of around 2.4 billion by 2025. That is expected. There are about 400,000 mobile application health mobile applications in India, and most of them are focusing around. There have been some questions. Okay, so yeah. If you look at some of the top use cases, those use cases are around fitness, diet and nutrition, mental health, women's health, and personal health records. While all of these things were happening, digital health is, of course, something that is adopted in large numbers by people. What is really the icing on the cake is the new initiatives and announcements by the government in the form of National Digital Health Mission, which aims or intends to build a digital health ecosystem for the entire country, on the lines of what UPI is today for the payment system in India. They intend to build a digital doctor platform wherein doctors are expected to come and enroll themselves and be able to provide teleconsulting to a large number of patients in the erstwhile unconnected and remote areas. The Health ID system, which is expected to connect all the information coming in from the patients, including their medical data, their prescriptions, their diagnostic reports, and so on, connected onto a single Health ID platform. Once these things happen, we are expecting to see a significant improvement in the quality of healthcare and an ability of the healthcare providers to provide much better services to their customers. Now, the point to remember is that this is not the first time that such an initiative has been taken up. Sometime a couple of years back, there was similar initiatives that were taken up, but unfortunately, they did not take off because of the monolithic and a gigantic structure that was thought to be made. The earlier attempts were to build up everything together on its own, to have the entire ecosystem, including from EHRs to the exchange, health exchanges, and so on, was sought to be built in one go. The current approach is extremely different. And that is the reason why all of us are extremely optimistic about the success of this new open health data ecosystem. The key points that I would like to highlight in this webinar today is the development of digital platforms on the lines of what UPI is for the payments industry in India. When the UPI came up, the payment industry all of a sudden had an entire ecosystem coming up together and building applications and driving in innovations in that entire industry. we are expecting a similar innovation and revolution to happen on the healthcare front as well. With open APIs, a direct consent, and a data layer, more and more innovation is expected to come across, providing a completely opening up of the entire ecosystem. So, I mean, just like I said that the open health ecosystem is expected to revolutionize innovation in the industry, and that innovation is coming in from the fact that there is a significant deviation from the previous approach, which was like monolithic architecture, to a decentralized system wherein we will be using technology and data and providing personalized care solutions to our patients. And these solutions would be built on top of data which is available from the health exchange systems that is expected to be set up. And once that data is available, we are expecting a lot of solutions on top of that data using AI and machine learning technologies to be able to use that data and provide actionable insights to help people build better solutions and ultimately help patients to keep a better control of their lifestyle and habits, and eventually can access better medical care. The technology to-do list, if I were to think of as to what exactly the healthcare institutions should have on their minds while building digital healthcare solutions, it starts off with simple solutions like basic scheduling for doctors. We need to have a simple appointment booking systems through which people can book not just consulting or not just appointments for the teleconsulting, but also appointments for the physical visits to the doctors. Being able to book them online will give a better control of their time, because they will be able to minimize the time that they spend waiting for their turn to come up at the hospital. So those are the advantages that are expected to come. Possibly, as there are more and more teleconsulting appointments, an ability to be able to better predict the wait times for the user will help us improve the experience for our patients. CT scans and an ability to analyze CT scans or MRI images with machine learning and AI technologies will give us a better insights into the diseases and lead to a faster diagnosis. So Mantra's approach has been, it starts off from primarily using technology to drive in efficiency enhancements, starting off with something as simple as inventory management, which helps hospitals to do a better control of their inventory, have a better visibility of their inventory, so that they are in a better position to control their costs. Second is, after this, the second tier of improvement can come in from improvement in the efficiencies of the process simplifications. Almost 20% of the consultations on 1 mg are done by an AI doctor, which is a clear-cut simplification of an existing process, which was earlier, you go to a doctor, the doctor will see all the reports, and then only you will get your prescription or advice from the doctor. Today, with one more layer of an AI doctor, which can help a doctor do his job much faster and easier. So that's a very significant step in the direction of simplification of the process. The third tier for the mobile first approach helps bring in efficiency across the entire spectrum. It's not just for the patient, it's the mobile solutions can be thought for a doctor who is managing his appointments. We can also think in terms of hospitals. We can also think in terms of mobile solutions for the back office, for the housekeeping staff, which is involved with keeping the rooms faster, which is involved with keeping the rooms cleaner and making them available for the next patient. So a mobile solution will help them become more efficient and more effective in their day-to-day jobs. And of course, the most important thing, which eventually with advancement of the technology that will come, is the data which is right now sitting in silos in various systems can be brought in together, because with the advent of an open data architecture coming from NHDM, we will see that these different systems start talking to each other, because now we will have an API interface, a standardized API interface for enabling them to talk to each other. We talk about some of the real world use cases here, what has been done across the world, across the industry, using AI for predictive inventory management. We are also seeing using AI for doctor consultations, where there are a large number of patients who are coming in for an advice from a doctor, and doctors are not in enough numbers to be able to see all of those patients. So hence comes the use or application of AI in doctor consultation as well. We have seen application of AI in pathology as well, where people are applying technology to make an early detection in cancer and other diseases by applying technology over there. There has been efforts from companies like Pathom IQ in that direction. Now that I have covered up some of these interesting real world cases, let's quickly talk about some of the use cases of our work with some of our customers. Our work with AbbVie has been on understanding of genes and their interconnectivity between various other genes. The data coming in from CRISPR or other frameworks, it could be coming in from research papers, is used to understand what is the connection and correlation between various genes and their impact on some of the chronic diseases using technology. Pathom IQ, of course, we talked about Pathom IQ earlier. Pathom IQ wanted to enhance the image processing techniques by allowing an earlier detection of abnormalities in treatment monitoring. And the benefits from this technology was almost 99% accuracy in terms of determining malignancy in tumor cells. I will also want to talk about some of the interesting work that we have done for some diagnostic institutions in our country, providing them with mobile applications for booking appointments with the patients, for managing their back office, for managing the medical test booking, video consultation with the doctors. There has been another interesting work that we have done with Manipal hospitals, wherein we help them manage their patient appointments through a mobile application, and helping them helping their patients manage their medical records, test reports, and other value-added services that can be directly accessed over the mobile application itself. Something extremely interesting is how do you really make the user journeys more interesting, and the answer lies in making them more gamified, giving them that small little nudge, technology nudges, to encourage them to do things that they would otherwise not want to do. But having small gentle nudges through technology will help them to take some of the corrective actions as part of their daily lives, and become more fitter and better, and lead a better and healthier lifestyle. Our digital approach is primarily based on 5 key factors. And starting off with knowing your customer better, have a common ID that works across all your channels, an omni-channel approach. We start off with smarter health journeys, compelling the customers to make a compelling decisions or decision journeys. We come up with personalized product recommendations and customer case journeys. Uh, Finally, an intelligent process to a smarter workflow for a smarter workflow, being able to intelligently process documents and give them better experience so that they don't have to worry about putting all the data within the digital systems. And of course, the product innovation improvements that can help in the final goal of winning the customer and ensuring that the customer remains with you for a longer duration of time. When I talk about what is the right way to build a right and a successful long-term digital health approach, we need to remember some of these key points here. That stay-at-home economy is going to be there for a long term. It's not going to stay. It's not going to vanish anytime sooner. And stay-at-home primarily is enabled by digital and AI technologies. So we need to be cognizant of the fact that the data which is available have to be used in whatever format and whatever ways possible to ensure that we are able to give the best possible services to our customers. Some of the fastest growing trends of the 2020 is to really make India Atmanirbhar in terms of the health and other facilities. Advancement of NHTM and an open health architecture will help us make some rapid progress on these fronts. How do you really build stickiness in the applications? Personalizations, giving a timely and a relevant advice will make users feel privileged. That's going to help them. And with gentle nudges, you essentially push and encourage the desired behaviors in your users. Your applications must be empathetic by design. You must think in terms of what you can use with the data and provide the qualitative experience based on the data to make your users feel that yes, the company or the brand that you come up from cares about their users. So you're giving them the personalized experience for them. And of course, you try to make these touch points as frictionless as possible by providing your mobile application or other channels to be able to minimize the actual human touch points. It could be in the form of being able to pay your bills without really having a need to stand up in the lines. It could be information that you might be seeking from a TPA desk, for example. So if we could think of use cases that could be solved by bringing those use cases on the mobile applications, I think all of those things would be extremely appreciated by the customer. And at the top of it, if you really gamify the whole experience, you don't make it experience look like, so here is your data and you make out whatever analysis you want to make out from it. But instead you use that data and make the analysis easier and more user-friendly and human-friendly for your users. That'll help you to build stickiness and constant human and a constant interaction with your customers. Towards the end, I would like to talk about some of the KPIs that we can possibly look at for a more successful long-term digital transformation. The KPIs that need to be looked at is the customer acquisition rate, your improved experience. How do you improve the experience and how do you measure it? So if you have an improved experience and you find that your users are coming across all the channels that you have built up for them, and your analysis of understanding as to why some of those channels may not be as popular as some other channels, and understanding and trying to improve on the experience on those channels as well, will help you to achieve some of your KPIs towards building stickiness around your digital health solutions. And of course, how much time do you spend on getting to market with newer products is another KPI that you need to be looking out for. to understand the success in your digital health journeys. And of course, being able to measure changes in the customer behavior and being able to use that data to bring about changes in your products and solutions will help build that stickiness and consumer love for your brand. And in case if anyone wants to have access to this presentation, we will be happy to share. Thank you so much for joining and have a wonderful day ahead. Thank you.